My name is Michelle Thulkanam, and I'm from South Africa, from a city called Johannesburg, also known as the City of Gold. I'm an external relations officer within the Health and Multilateral Partnerships division at WHO, and our department is responsible for facilitating and guiding strategic partnerships that are relevant, well-governed, and are in the best interest of the organization, and that contributes to WHO's strategic mandate and policies. Some examples of our work is we started the COVID-19 Solidarity Response Fund. We've also established the WHO Foundation. We work with the private sector, civil society organizations, NGOs, and various other partners. And another very recent example of our work is the Global Youth Mobilization Initiative, where we are looking at improving the health and well-being of young people affected by COVID-19. I work in WHO's Goodwill Ambassador program, and I also WHO social media influencers and support the WHO Foundation. And I've also been working more recently on the WHO World Health Museum. The Goodwill Ambassador program is something that is really exciting because we know that we need to reach different types of people and audiences. Working with celebrities or prominent individuals, we can reach people with our messages in a more engaging and relevant way. And I guess that's what I love about WHO. There's so much scope to always challenge yourself and grow. People don't understand what WHO does because we're not as equipped in telling our story at the country level. So I'm very cognizant working at HQ about making things more easier, accessible, user-friendly for country officers so that they can support the government better. We are ultimately here to serve. Prior to working for WHO, I worked for the Office for the Coordination of Humanitarian Affairs. So they were looking at floods, cyclones, food insecurity, drought, HIV/AIDS, to even political instability. And that's where I really started to get exposed to what WHO does. What fascinated me is that WHO does so much. It's not just an emergency-driven organization responding to disease outbreaks, but we are involved in maternal and child health, immunization programs, Alzheimer's, mental health. It's a very under-resourced organization for how much it does. And what I really loved doing is supporting partners, the Ministry of Health, in reaching communities with health advice or supporting health workers with important health information. I love working for WHO because of its mandate and what it stands for. I love its mission, which is health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That is a very, very powerful statement to me. If you think about what WHO does, we are there at every single touch point of your life, from the moment you're born, when you get weighed, to breastfeeding advice, to when we go to work, occupational health and safety, road safety, when we buckle up our seatbelts. As an adult, how do we manage non-communicable diseases, to when we are dying, when we focus on palliative care, so that we can end our lives in dignity and without pain and suffering. I find that working and contributing to this mission is so important because without health, we are nothing. We cannot be productive citizens of our countries. And I'm somebody that wants to serve. And I love supporting WHO and the countries that we work with achieve better health for everyone. That's why I love working for WHO.